Hey everybody, it's Rachel with drugfreebirth.com, and I want to come on and make a video about writing your birth plan. So whether you are planning on having your baby at home, at a birth center, at a typical hospital, whether you're working with a midwife, whether you're working with a typical OB practice, um, whether you are planning on perhaps a non-natural birth, so maybe some interventions there, or you're trying to go all natural. A birth plan is really where a couple, an expecting couple, can start to really um, keep keep control over what's going to happen as much as possible. Okay, so we all know that every birth is different. Every situation is a little bit different, but there are some mile markers, there are some guidelines that you can stay within to really communicate to your birth team what your wishes are and to really maintain the attitude and the expectation that you want to go in with. So let me go over some of this with you. And if you're expecting parents and you are planning your birth right now and you're starting to look at birth plans, this might be a good starting point for you. Okay, so firstly, a birth plan is something that a couple is going to do together. And so this is one of the first times you may be making some decisions together as a couple that aren't simple things like what color are we going to paint the nursery or where shall we go out to eat for your birthday, that type of thing. We're really doing some real kind of communication and maybe even some research, and we're going to be making these decisions together as a couple. So I think it's great whether you've been married a few months, a few years, or more. Sometimes couples haven't had decisions like this before in their married life, and it really is great for just increasing communication and just learning how to communicate with your spouse. So I'll tell you from experience, I have had three children, and each one of those were unmedicated. So in my birth plan, and I'll share with you what I have put in my birth plan, but a lot of the things I put in my birth plan can really be used by many different types of labor plans, I would say, and different philosophies, I guess. So let me talk about writing the birth plan and then kind of what we're going to do with it. So firstly, I really like it when couples can write their birth plan anywhere from, say, 25 weeks to, say, like 35 weeks of gestation. Okay, so you really don't want to start writing your birth plan when baby's due tomorrow, although you can do that. But the reason why I like you to write it early is because I really want your OB's eyes on the birth plan. All right, so I want you to write your birth plan and I want you to bring it into your provider and have them take a look at your birth plan. Okay, so let's say you're plugging along at you're say 28, 29 weeks or so. You've got a draft of a birth plan. I want you to bring it into your doctor's office during one of your typical checkups. And I want you to say, hey, doc, here's what we're thinking about our birth. What do you think? And let him or her take a look at things. And if there's any red flags, if there's any pink flags, your doctor's going to be able to take a look at that. Let's just say you wanted to have all your sorority sisters in the room with you during the birth, for example, and you wanted to like live stream it or something like that. Well, your doctor might say, actually, we have policy against blah, 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 right? So you're going to be able to cut off some of these things at the pass and really be able to understand, say, what's allowed, what's not allowed. I think one of the typical things that a lot of people I coach want is they want to explore the possibility of, say, a water birth, right? They want to have a labor tub and they want to possibly have their baby underwater. Well, if you go to a birth center, a lot of times that's going to be a-okay. If you're in a home birth, no problem. If you're in a typical hospital system, and I'm here in the Raleigh area, so we've got UNC, we've got Duke, we've got Chapel Hill, we've got what UNC and Chapel Hill, same thing. We've got Rex, we've got Wake Med. So we have a lot of good, well-respected hospital systems here. And a lot of these, unless policy has changed at the time of this recording, they will not let you push the baby out, say, go into second stage of labor underwater. They will allow you to, say, take the edge off, labor in the labor tub, but when it comes time to start pushing, they're going to want to have you out and back on the bed. So that might be something someone puts in their birth plan, and then if they don't get doctor's eyes on it prior to, they're going to get into the hospital expecting to be able to be in that labor tub for the whole time and have to be told, actually, we can't do that here. So that's why I really like it when the doctors can see things prior to. Now, I had a really chill doctor that happened to look at one of my birth plans one time, and he just looked over everything and he said, "Hun, you can swing from the chandeliers if you want to, as long as you're healthy and the baby's healthy. You can do whatever you want, basically, when it comes to like different positions." And I thought that was pretty interesting. So not every doctor is going to say that, but I think if you have some of the basics down, you're going to be pretty surprised that your doctor is probably going to allow lots of things. Um, Another thing I would really like you to do prior to is not only get your doctor's eyeballs on it, but if you're at a bigger practice, I really like it when you can go and make appointments with every doctor in that practice. Now, I know what you're going to say. You have one doctor that you've fallen in love with, and they're the best, and they understand you and they get you, and the other ones, they're old fashioned, or they don't connect with you, or their bedside's not great, or whatever it is. Okay. But it's really important to have each of those doctors take a look at your birth plan because they might be the one to catch that day. You don't know how it's going to shake out, who's going to be the attending doctor on call or on the floor that night or that day when you have your baby. And you don't want to have a doctor that's never seen your birth plan because you kind of just fell in love with one of the doctors and now they're the one that's catching and they're kind of catching up by reading your birth plan that day. Okay. So I say shop your birth plan to every doctor you can in the practice, okay? And make it a point to have an appointment with every single one of those as you go through. And then as you have your favorites, you can stick with them the rest of the time if you really like them, but at least you've had every doctor take a look. Now, in that same vein, what I really encourage couples to do is not only say, "Hey, doctor, take a look at our birth plan, see what you think." And when everything looks good, then, "Hey, doc, can we get your initials on this so we can remember that you've seen it?" So that way, also, not only can you kind of check off all these doctors that you're seeing in these appointments, but at the same time, when it comes time to for the big day, your doctor will see their initials on your birth plan because you will have made copies. Okay. Another point in that same vein is making copies. Okay. So we'll talk about how to present the birth plan, say at the hospital, for example. But you do want to plan on not only letting each of the doctors in your practice read over your birth plan, ask any questions, make any adjustments along the way, get their initials once you finally get that final draft. And then you want to bring, say, 10 to 15 hard copies, printed copies with you. Okay. So I'll talk about that briefly about why you're bringing so many hard copies, even though the birth plan very, very likely might be in your chart. So in your electronic chart, as we move forward with electronic charts being able to be shared all over the place, should you change providers, that chart can just be sent electronically right over. You still want to have the hard copies, and we'll talk about why that's so important. But some of the highlights I think in a birth plan are really if you are going for unmedicated versus any interventions. Okay, so an intervention might be, say, breaking the water. It might be what's called sweeping the membranes to kind of keep labor progressing or to get labor started or to maybe even speed up the process. Okay, so that might be something that would be considered an intervention. Another intervention might just be an induction. So it could be an induction on the calendar. Other interventions go into, say, pain management. So offering things like offering pain meds, certainly going into the epidural route. There's lots of things that can be offered to a mom. And if you've chosen as a couple to have an unmedicated birth, you really want to put that in your birth plan. Specifically, mine says we're planning for an unmedicated birth. We understand that there are procedures that may be necessary, but except in the case of extreme emergency for the mother or baby, we ask to be given the opportunity to accept or refuse any procedure. We ask that the least invasive or restricting versions of procedures be used, such as an external monitor. Okay. Also, when it comes to pain meds, I have written, please do not offer chemical pain relief. And that the reason why we write this in there, if we're looking to have an unmedicated childbirth, is because there's going to be some very nice nurse who is very well-meaning, who may or may not be aware of the fact that you want to go unmedicated, for example, and she's going to say to you, "Honey, you look so tired. The anesthesiologist is on the floor, or let's go ahead and get you that pain med before things are too late, or let's go ahead and get the epidural going for you." And a very vulnerable mom in hard labor, sometimes she may feel like, okay, fine, it's my last resort, when really she's been preparing the whole time for unmedicated birth. So it's good to kind of have that in there. And then if mom and dad together, for whatever reason, decide, actually, we're going to go through, or actually, we'd like to learn more, or actually, we'd like to consider some pain medication or pain management, for example, then as a couple, they can choose to override their birth plan, right? But it keeps the nurses at bay from offering it too much. And then when a mom gets really tired and feels vulnerable, then she may just say, okay, let's go for it. Not that there's anything specifically wrong with any intervention necessarily, depending on who you read and what your personal philosophy is, but sometimes interventions can lead to more interventions, right? So maybe augmenting the labor, say with Pitocin, maybe to speed up the labor, for example, that can cause more pain that the mom's not ready for. Then we're talking about some pain management. Okay. So, maybe sometimes doing one thing might lead to something else that mom and dad really didn't think about in the beginning. Okay. So I like to put that in there. Put that in there if you are going for unmedicated. Okay. And certainly there's classes to take to prepare you for unmedicated, should that be your wish. Another thing that I like to put in the birth plan, that might be kind of an urban legend still, is that a lot of people still think that you can't eat or drink during labor. And this is kind of an old residual, not myth, but it used to be the case, but now it's not so much the case. If you're scheduled for surgery, if you're scheduled for procedure, for example, a C-section, of course, you're going to be dedicated to, you're going to be told, do not eat or drink because of the anesthesia. Okay. However, if you are healthy, an uncomplicated gestation that you've been experiencing, baby's healthy, you're healthy, there's really no reason for you to be denied food and drink. Now, a mom in hard labor is typically not going to be hungry. Okay. However, you do need the calories and you do need the hydration. So having, say, I always use like coconut water, for example, like I have my coconut water with me. Having some food and beverage on hand that you maybe put in your hospital bag is perfectly okay. All right. So again, it's still kind of a residual out there where sometimes moms might share that they just know you can't eat or drink during labor, and that's not true. So what I like to encourage people to do is put that in the birth plan. I had written in mine, during labor, we would like the ability to access food and drink during labor. And so that way they know that we know our rights. Okay. So that way, no, of course, I don't think they're going to, take anything out of your hand necessarily. But this just prompts you to put this in your labor bag, for example, some electrolyte beverages, maybe some protein bars or something like that, some snacks, some fruits that you might want while you are, say, between contractions or whatnot. Certainly, sipping some beverages might be really, really helpful between contractions. Okay, so I like to always put that. Let's talk about freedom of movement. A lot of moms, I guess unprepared moms might go into the hospital and just assume that they have to be hooked up to wires and tubes and such, and possibly even lay flat on their back during labor and delivery. And that's not the case. So a lot of the parents that I coach who are choosing non-medicated, unmedicated birth, what they write in their birth plan is that they want the ability to walk freely and move freely, including changing positions, including possibly laboring in the shower or the tub, being able to walk around, say, the labor room, for example. And the only reason that they might not do that, not be able to do that, is if they'd be hooked up, say, to an IV. Now, of course, it's very important to be able to administer fluids should a laboring mother need it. But there is something interesting that you can do, that you can request to avoid that and kind of find a happy medium. And what that's called is the HEP lock. Okay, so basically it means in triage, you're going to be given a nurse is going to find a vein, okay, and they're going to go ahead and open up that vein with what we call a HEP lock, but then they're going to close it off. And so if the time should come for you to need fluids, say during labor, then there's no need to find a vein at that point. The nurse can just quickly attach the IV fluid materials to that HEP lock, and you're good to go. But having you free to move about is really good for mom and baby during labor, because you might find a position that just works really well. It's feeling really good. It's helping baby get down into position, or it's helping you push more efficiently, and you're not tied up, literally tied up and tethered by pumps and fluids and all that stuff. Okay. All right. So think about that. Also to monitoring. So every laboring mom needs to be monitored. Of course, they want to make sure the baby's heartbeat is good. They want to make sure your vitals are good. Okay. So there's a couple different ways to monitor while you are having your baby. One is what we might call intermittent monitoring, and that might just be with a stethoscope at the bottom of your belly to get baby's heartbeat. Okay. And sometimes moms even wear a little, what looks like a little pager on the belly. That's kind of a middle of the road one. I really don't like that, to be honest with you, because it always slipped off my belly. But it is one step away from what we would call more of an invasive monitor. And that's where a probe is actually, or a monitor is actually placed onto the baby's head, and his heartbeat is monitored that way. Well, that's more invasive. And plus, you can just imagine there's wires and such that are attached at this point. So movement is restricted at this point. All right. So you can do your research and talk to your doctor about these options. But a lot of the moms that I coach end up with just the intermittent monitoring with the stethoscope instead of wearing the monitor, or certainly having the invasive monitor in there. Okay. It only provides for more freedom of movement. It's still a great way to monitor baby's vitals. Okay. So think about that. Another thing is the birth environment, and coaching parents for several years now, there's lots of different things you can do in the environment. Some people bring their music, some people bring their own pillows. Some people ask for the lights to be kept low. We didn't go super far down that line, but what we did do is ask that the environment be kept calm. We really wanted things to be calm. And so what we wrote in our birth plan was that just the fact that the birth environment was important to us, we asked that the lights be kept lower if possible, that excess noise and loud voices be avoided, and that the door be closed for privacy. All right. Some people even go so far as to say they don't really want students in the room at the time either, and they just want only the necessary, say, team of nurses and the necessary doctor there. So if you're in a teaching hospital, that might be something you consider. Now, certainly, if you're having twins, or if you're kind of a different case, maybe you have a very large baby or something like that, you're probably going to have some people want to come see other doctors that day, maybe some students there, but that's still your right if you don't want them in there. Okay. But I found it really interesting that the nurses, they read our birth plan and they did keep the lights dim. I didn't even know you could do that in a hospital room, actually. Their voices were low and calm, and the door was kept shut. And I really appreciated that. I really did. It helped me just focus, helped me just stay calm and relax. And all three of our births were just chill and quiet. And that's really how it should be. So I enjoyed being able to notice that they really did that for me. Let's see here. Now, talking about the father, depending on dad, what your role is going to be, I really like to put that in the birth plan. So certainly if you're going to cut the cord, then we put that in there. Our very first point in our birth plan was who we wanted to have present. And in fact, for each of our births, except for my first one, where I had my mom with me as well, we just wrote that we just planned to have present the father. Just so that they knew that he had a role and that he was going to help coach me. Okay. Now, dads, when you're there, now, if you're taking a class on natural childbirth or any other type of class, you're probably noticing there's lots of things you can do for your wife to help keep her comfortable and focused and all of that. But we do put in our birth plans that we literally what we wrote was we ask that any questions, suggestions, or concern to be delivered first to the father to avoid adding unnecessary stress to the mother. And then he can relay the message to the mother himself if he finds it necessary. Okay. So that might be something where, let's just say, there's a shift change and there's a new doctor that comes into the room. Well, maybe dad can kind of do some of those introductions first while mom is getting through some contractions. And then at the right time, say after a contraction, then he can um, have him come over and introduce himself to mom. Other things, though, there might be a concern, for example, like, hey, we really want to get this birth progressing a little bit faster, or which is questionable, but it is something that might be said. Or, hey, we're thinking of offering her some pain medication just based on blah, 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 blah. Well, that might be better given to the father first, and then he can chat with mom. Okay. And the reason why is because we really want to keep mom completely relaxed, stress free. We don't want to have her feel like she has to be this good patient and be polite and make introductions to everybody. We want her in her zone. Okay, we want her getting through every contraction, staying calm. And one way to do that is let dad kind of run blocker for her. Okay. So think about putting something like that in there. Um, we also put something about induction. All right. So a lot of times if someone's going to be induced, it's going to be way before mom's in hard labor. Okay. But we did still put it in our birth plan because, again, the birth plan is something that's being given to and presented to our birth team way before baby comes. Okay. So what we wrote about induction was that if induction becomes necessary, we ask that non-chemical methods be tried before the chemical methods. Okay. Such as maybe walking, there's nipple stimulation. A couple can have sex. Okay, so there's lots of things that can be also correlated to getting labor started. Okay, that aren't chemical interventions. Now, when it comes to other interventions such as sweeping the membranes, like I mentioned, breaking the water, using cervical cream, that might be kind of a middle of the road that somebody chooses before going into a true induction, which would be, say, Pitocin that's administered by drip, okay, in the hospital. All right. And then we also wrote, we prefer that the least amount of Pitocin be administered with increases upon our consideration. So again, couple is staying in control here. And then the nurse team is checking in and getting some really good communication from the couple for doing anything. Okay. If you know anyone that's had a baby in the last couple of years, you probably know somebody who might have been feeling like they were kind of on say a slippery slope or a roller coaster or conveyor belt of just kind of suggestions and interventions along the way. And they kind of might have felt out of control. Okay. So this kind of keeps things within the guidelines and the guardrails. And then if there's something that needs to be called, say an audible needs to be called and mom and dad need to make a decision on something, then they can use informed consent to do so. Okay. And we can talk a little bit about that. Okay. Let's see about positions. So what I like to encourage couples to write in their birth plan is either the positions they're thinking of using or the fact that they just want the freedom to explore any positions out there. Okay, so that might be squatting, it might be all fours, it might be pushing on hands and knees. Okay, so they're using a squat bar, using say a birth ball. Okay. Some people might even squat, say, on the floor. Okay. Say on a sheet or a chucks pad. Okay. So if we put in there that mom wants to explore, say, any position that's comfortable, then that avoids nurses saying, okay, you need to get flat on your back so we have a good view. And it avoids mom feeling like she has to be kind of told what to do, okay? Because she's going to be listening to her body. She's going to be feeling every sensation, especially if she's unmedicated. And she's going to be able to make these decisions for herself while recalling her training and while recalling the things that she's read, while exercising her rights to be mobile. Okay. So again, having that hip lock versus being hooked up to an IV is going to really help her explore those positions. Okay. Pushing. Sometimes moms feel like they just are going to be told when to push, be told how long and how hard to push. And that's not really the case. You know, really well-trained mother is going to know that she can push at her own pace and push to comfort. Um, and so doing that, putting that in your birth plan is really important, in my opinion, because it helps the nurse team know that they could maybe suggest to use, like, hey, mom, you're 10 centimeters, you're welcome to push whenever you want, that type of thing. That's great. But saying, okay, on this next contraction, I want you to push, that's going to be a different experience for mom. Okay. So now if mom wants the coaching, if once she's 10 centimeters, she wants to tell the nurses, hey, will you tell me next time to remind me to push? That's great. That's awesome. Or maybe dad just helps her, or maybe she just feels the uncontrollable urge to push, which I'm sure you may have read about. Maybe she just feels that and she wants to go with that. Okay. But putting in the birth plan, I think, is important so that the nurses know kind of what flavor this mom is and what she wants and what she doesn't want when it comes to coaching. Okay. Let's talk about after baby gets here. Okay. So you're holding your cute baby. In the birth plan, a lot of mommies are going to put in there that they want to say nurse immediately. They want to have skin to skin contact immediately. Maybe the dad wants to cut the cord. Let's talk about cutting the cord. Okay. A lot of these moms that are going unmedicated, they're going natural. They have learned that they really need to wait until that cord stops pulsing, till it turns color. To know that all that blood flow has gone from the placenta to the baby, and now it's ready to be clamped and cut. Okay. So if you look on TV, if you look at the movies, baby pops out, they cut the cord immediately, and everyone, you know, in the old days, the men would all fire up a cigar. Okay. So it's really not like that. It's really not best practice for the baby to cut the cord right away. Okay. So I like to put that in the birth plan so everybody knows that there's going to be a waiting period. Now, it could be, say, 10 minutes or so, it might be a little bit less, but everyone's going to be monitoring that cord while mom has baby on her abdomen or on her chest or even to the breast. Okay. So think about that. Also, some moms, they want some of the preliminary evaluations, say the APGAR rating and things like that, maybe pulse, temperature, to be taken while she's holding baby right there. Okay, so it's not federal law that you have to have your baby swept away over to a little table to have all these tests done right away. Okay, you can hold that baby while some of those tests be done. And then you can follow up with doing some other tests, say the weight and things like that, within those first, say, 2 hours that you're kind of beginning that recovery process. Okay. Other situations, other challenge or options that you might have might be, say, to delay or prolong a bath, the first bath. Some parents choose not even to have that baby have a bath until they get home. So there's options for that. I do encourage parents to ask for the APGAR rating with, say, a paper copy upon discharge, so that they have that. And for information on APGAR, it's the acronym, so APGAR: appearance, pulse, grimace, aspiration, I believe, and respiration, I believe. I have to check on that. So take a look at that and see if that's something that's important to you to be administered to you, to be given to you in writing. Okay. Let's talk about C-sections. Now, a lot of the couples that I'm coaching, they're going for all natural. They never even have the conversation about the C-sections because they have these cute babies pretty quickly. They've labored at home. They go in, they have their babies. But every once in a while, of course, we know that a C-section can be deemed necessary. And I like to have the couples at least put a little bit of language in there just in case. Okay. And so what I've written in my birth plans is that if cesarean becomes necessary, the mother would like to be conscious and the father would like to be present at all times. And we still prefer to nurse our baby immediately. Okay. Now, barring any real emergency circumstances where that might not be possible, most of the time that's going to be granted. But it's always good to put it in the birth plan that that's what you want. Okay. Um, and then let's see, I happen to be kind of, more of an introvert. And so I just happen to put in here in my birth plan that I don't want any visitors. That wasn't really necessary, I think, because it's not like they're just gonna, well, I guess they would just let anybody come in after they get checked in. So we just kind of asked, hey, we don't want any visitors right now. We'll know if someone's going to come and we'll tell you to allow them into our room and to come visit us. But really, during those first, day or two after baby comes, you're just focusing on getting breastfeeding started, just getting to know your baby, just kind of getting a little bit of rest, of course, taking that first shower after you have your baby, all of that stuff. And I just really didn't want to be entertaining a lot of visitors, to be honest with you. I said, you know what, baby's still going to be cute next week. The baby's still going to be cute within the month or whatnot. So I can just have visitors at my home at the right time. And so that's why I did that. Okay. So if you want more input, say maybe on a birth plan that you're writing, I encourage you to get in touch with me. If you want to see an example of some of these birth plans that I've collected along the years from some of my clients, and of course my own, please contact me as well. Let's talk very briefly about how to present this birth plan. Okay, so we already know, we've talked to the doctor about it. We've had all the doctors take a look at it. We've got their signatures or their initials on it. We've made 10 to 15 copies. Okay, so this is where dad comes in. Okay, so we are coming into the hospital, we're in triage, and then we're going to go into the labor room. And dad is handing out these birth plans like he's running for office. This is what I always say. And I want you, dad, to present that birth plan to each nurse on the team, and certainly to the doctor when the doctor arrives. And I want you to say, hey, here's our birth plan. I'll give you some time to read it. Please let me know if you have questions. We're really excited to be here, and I know you guys are going to help us out. I know that we're with the best of the best, that type of thing. So, dads, I really want you to work the room. Here's what I'm trying to say. I want you to set the expectation that A, your birth plan is intentional and you've taken time to write it. B, you expect them to read it. And C, you expect them to do what's on your birth plan. Okay. I have heard people say every once in a while that no one reads birth plans. That's an outdated practice. There's no need to do that. I don't believe that at all. Certainly from the people I've been coaching and certainly from my experiences, it's a really great starting point. It's a necessary starting point. Okay. So dads, you're handing this out. Now you're bringing 15 copies because you could have checked in, say, an hour before shift change, and now there's shift change, and now you have 4 other nurses and another doctor. And then mom's going to push and say 30 minutes or something like that. Well, you're going to want to hand that birth plan out again. Okay. You're going to want to really be sure that everyone has seen this. Okay. Now, certainly things that you also want to put in there that I really didn't get to are any of the newborn procedures that you either do or you don't want. Okay. So I know you're probably doing your research on this, but we're talking about the Hep B vaccination, say circumcision, maybe the eye ointment, the vitamin K. So all these newborn procedures that are pretty typical, a lot of, I guess, maybe brand new parents, or as you're just starting to explore the whole idea of having a baby, so you might think that all of these are pretty standard and that everybody gets them no matter what. Well, that's not the case. You can pick and choose. Now, I never tell my clients what to get, what not to get, because it's certainly their decision. But I will say that you have the right to put into your birth plan what you want, what you don't want. And then if you want to call an audible and say, you know what, I know we said we're not going to do vitamin K. Actually, we've done a little bit of reading. We're okay with it. Then it's good to go. You're good to go. You don't have to go update everyone's birth plans, but you can just say, you know what, on our birth plan, we wrote that we don't want it. We're actually going to consent to that. So if you don't mind, if you can just make sure the nurses know that type of thing. Okay. So that way you have some flexibility, but at the same time, you can always just go back. Let's say a nurse forgets. You can always go back and say, actually, nurse, we wrote on here that we're not going to do the vitamin K or whatever it is. So actually that was already on our birth plan. So we're not going to do that today, but thank you, that type of thing. And then things just keep going. Okay. So think about that. I do encourage you to reach out with questions. I love talking about this subject, and hopefully that helps you a little bit as far as knowing what to expect and the rationale behind having a really great birth plan. So thanks again. This is Rachel with Drug Free Birth, and we'll talk soon.